United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Right. So Chloe was unable to join us this evening, but we do have minutes from November 17th. Just wondering if anybody had any additions or changes we can note and contact Chloe regarding them. I don't know if anybody had a chance to take a look. Concerns? All right. Okay. And move to approve?
Motion.
A second?
Second.
Excellent. Thank you. I will make my parting gift doing the minutes for this evening, and I'll type them up and send them on over. All right, so
Just before we move off of minutes, I made the promise that I would make some typos and corrections for the 2 previous minutes, and I failed in my task, having forgotten that today was the day that I'd have my annual eye exam, and I put today aside, and I simply couldn't do it, but I promise that I will take care of that and submit those changes.
that will be your parting gift.
my parting gift.
All right. All right, so bringing us to organizational issues. So tonight is my last meeting with the board, just because I was nosy and I'm terrible with dates. I did look back, and I've been with the board since June of 2019 when Linda was chairperson. David was already here, and so David's been at least here since 2019, and I'm pretty sure for 3 or 4 years prior to that as well. At that point, I quickly got involved with the intern program. For the first 2 years, basically worked with Jane Karabasi, who she kind of took care of everything, and I just watched what she was doing. And then since then, I've had the pleasure of working with interns for 5 years. So I guess I have worked with 10 student interns over my time. I'm not including last year since I didn't end the year with them. But for the past year, obviously, been the chairperson. So I've enjoyed being with the board, and I'm excited to see kind of what happens from here on out. I'll probably be like Alex, kind of spying and seeing what's going on. So tonight is also Seth's last meeting and David's last meeting. And David, did you discover how long you've been?
Yeah, so I've been here 8 years, 4 of which I was the chair, and I am compelled by Township ordinance to be off for at least a year because I have had 2 consecutive 3-year terms, and I actually started as a stand-in for an incompleted term my first 2 years. I want to take a moment to thank all of the permanent staff who have been very, very helpful throughout the course of the years, and all of the Board of Commissioners who have given us the opportunity to serve the township and help provide them with the consultative services that they need to address the health issues of the township. And it has really been a dramatic time. When I got here, there was no county board of health. We did our own food inspections. When the pandemic came along, we were ill-prepared to manage that because of the absence of a county organization. And still we've muddled through and been able to serve the people of the township. And it is a position that I am grateful to have served in. It has been a pleasure, and it is with fond regrets that I say farewell. Thank you.
We do have the pleasure of having a new board member with us this evening, Melissa Zaffin. I asked her to just speak a bit about herself so the other board members can get to know her.
Okay, thank you. I'm Melissa Zaffin. I am currently a board member on EAC. I have around 20 years experience in the medtech, consumer, and pharma industries, working in medical and patient safety, and working in the regulatory environment. And currently I am a director of strategy and operations for the Office of Chief Medical Officer for the Innovative Medicine team. And that's some of my background. And I have had an interest in joining the Board of Health over the last year. I've been a Radnor resident for around 5 years now, and I have 3 kids in the elementary school here, and just excited to be part of this community. So, thank you.
Welcome, Melissa. All right, Dave, your last communicable disease update.
So it is really, really hard in an era of completely degraded public health information that we live to have actual quantitative reports. We've been remarkably lucky so far this year with regard to getting to December 16th without any major or definable outbreaks. COVID activity appears nationwide to remain somewhat low and sporadic. Flu activity has ticked up substantially in New York, with the latest data being for December 6th, but it appears to be ticking up everywhere. Get your flu vaccine if you haven't gotten it, and really critical hand washing and protection from exposure. RSV, there is an interesting discussion going on right now, because we're about a month into what should be the RSV annual outbreak, and there isn't one, and it's not materializing, and there are those who would suggest that this is just another example of the power of vaccination. We're 2.5 years into the availability of RSV vaccines, and this is kind of what you would expect, and it's happened time and time again. First time in this country was in January of 1776, when George Washington inoculated all the troops in their encampment at Valley Forge, and we've seen it time and again. So we may or may not see an uptick in RSV, but we haven't yet. There was a single death from an atypical avian flu that appears to have been not a human-to-human transfer, so avian flu, there's nothing much new to report. There does appear to be a nationwide bump in norovirus, which is something that you want to devoutly avoid. It's just no fun for anybody. And again, all of these communicable diseases, hand washing, avoiding face contact with your hands, and avoiding circumstances where you know there may be, and being kind to your neighbors if you happen to be infected with something. I think that's all I have for you. Good night and good luck, I think, is the way you close out one of these, isn't it? Thank you.
I did kind of skip over important health dates on the agenda. One thing is that, interestingly, the December 4th through the 8th was National Influenza Vaccination Week, as we've talked about, a little late than when you want to get it, but any time is a good time to get your flu shot. So if you haven't gotten it, please consider doing so. Another just thought is that December is HIV and AIDS Awareness Month. Someone who's been around for a while, myself, from high school when HIV was a death sentence, to all the options and availability of treatments that we have today. I mean, it's a very important issue that we continue to keep in mind, and encourage patients to get screened if they need to, or encourage our family members if they have any concern to do so. All right, so a little student intern program update.
So recently I've been doing some background research into some strategies that people can use to manage day-to-day functioning, such as pacing and prioritization methods. I've also looked into how mental and physical health can affect motivation and concentration, and what kind of supports are commonly recommended.
Recently, I had a personal experience that inspired me to appreciate the importance of knowing your family medical history, and that inspired me to change my project topic. I'm aware that it's quite a big switch, but it's very near and dear to my heart, and I believe that this project could have a large impact. In the era of modern medicine, we know so much about how to intervene early in disorders and about hereditary patterns. Doctors can provide better and more effective medical care when they know about their family's health history. There have been so many innovations in treating treatable illnesses such as diabetes, cancer, or thyroid disorders, but there's also a common wouldn't happen to my family mentality that can prevent early detection. This project would involve public education and materials that can be done outside a doctor's office, making this initiative accessible to all, including marginalized communities. Additionally, recent polls have shown that younger adults, millennials and Gen Z, have been less likely to go see their primary care doctors, which is obviously a major problem, and are primarily seeking care at urgent cares. And knowing your family health history is just essential to all medicine that you need. So that is where I'm switching my project, and in the coming weeks I will be doing research with members of the Jefferson Integrative Health System and interviewing the genetic counselors there.
I think it's an excellent, excellent idea. I mean, as someone who sees patients daily, there's a lot that do not know their family history. A lot of times a visit is an impetus for them to go and ask their family, and they come back the next time and go, oh my gosh, I didn't know my uncle and my grandfather had diabetes in my instance or had thyroid disease. So yes, I think that's an excellent thing. I mean, I remember being in medical school and they would be like, can you tell us about your family history? And I'll be like, my grandfather died from cancer. And they'd be like, what kind of cancer? And I'm like, I don't know. I never really, I probably should have asked about that, right? Of course, some cases we don't know the original site of the cancer, but until I, spoke with my parents, I didn't know, right? So it's something very important for people to be aware of from the time that they're young, in my opinion. It's great.
It's also a great time of year when everybody tends to get together with their family to kind of align and get your stories straight, as it were, with your siblings and generations before and after.
I think there's also a bit of stigma as well. In my own family, there was a case where a relative had to get closer breast cancer screening, and they were like, "Well, we don't have a history of breast cancer in our family." And then my mom goes, "Well, actually, your this relative, they just never really told anyone about it." So especially for certain types of reproductive cancers, that may also be the case. Okay, well, this evening we have a presentation. So Roberta Winters, who's treasured community member with the League of Women Voters, they have had some student intern projects over the years. I actually, let's see, I've been here for 5-6 years. I think about 3.5, 4 years ago, we had a student do a wonderful presentation about accessibility of our disabled parking spaces for the board, and that actually led me to want to suggest to my student intern looking into kind of bike accessibility in the town. So I think this student intern project from another part of our community, we can take kind of advantage of and learn from them. So we have two students who are going to be presenting this evening. They are Nicole Hartono and Nikki Malore. So come on up, ladies. And so they have a little presentation for us on the medical and legal factors involved in rape.
Okay, so as you know, our project is about supporting. Oh, sorry. Wait, is it okay? So as you know, we did our project on supporting victims and survivors of rape from a legal and medical perspective. Pennsylvania legislature defines the crime of rape as when a person engages in sexual intercourse with a complainant by forcible compulsion, by threat of forcible compulsion that would prevent resistance of a person of reasonable resolution, who is unconscious, or where the person knows that the complainant is unaware that sexual intercourse is occurring, where the person has substantially impaired the complainant's power to appraise or control his or her conduct by administering or employing, without the knowledge of the complainant, drugs or intoxicants or other means for the purpose of preventing resistance, and or who suffers from a mental disability which renders the complainant incapable of consent. So if a person is convicted of rape, their sentence depends on factors such as the victim's age and the nature of the crime. The standard sentence for rape is 20 years in prison at most and a $25,000 fine at most. If the victim is a child under 13, the maximum sentence is increased to 40 years. If the child sustains what the law defines as serious bodily injury, which is, according to the Pennsylvania legislature, bodily injury which creates a substantial risk of death or which causes serious permanent disfigurement or protracted loss or impairment of the function of any bodily member or organ, then a life sentence becomes the maximum. If the victim is a minor under 16, the sentence is at least 10 years. If a rape involves the drugging of a victim, which would affect consent, an extended sentence of the standard one of at most 10 years and an added fine of $100,000 is also possible. So, as this is kind of outdated, but as of August 21st, 2025, there have been 1,799 rape cases that were reported, and 933 of those cases were closed.
What are sexual assault examination kits? Sexual assault examination kits, also known as rape kits, are a critical part of the medical forensic examination to collect evidence after sexual assault. Specifically, these kits are designed to collect DNA evidence from a survivor's body and clothing that can provide information in identifying the perpetrator and aid in the prosecution of the case. Additionally, throughout the examination, injuries from the attack are documented and treated, such as bruises, cuts, or signs of forced entry. Photographs of any visible injuries may be taken to document the extent of harm caused. However, there are limitations to these kits, as they cannot be performed if the patient is intoxicated or if they are mentally unstable. Kits are used in exams are typically completed by sexual assault nurse examiners, or SANEs, though doctors or nurses can also perform the exam. The examination lasts 4 to 6 hours, and ideally, kits should be completed within 72 hours after the assault. Kits can be stored for months or even years before a match is made for the perpetrator. SANE programs play an essential role in the prosecution process. Research shows that the programs with SANEs significantly increase evidence collection and investigation in sexual assault cases, which results in significantly higher prosecution rates. Once examination is completed, kits are taken by law enforcement and are analyzed in a crime lab unless the kit is a restricted kit, which is when the victim does not want their kit to be released to law enforcement or analyzed in a lab. Sexual assault examination kits typically contain instructions for the examiner, forms of documenting the procedure and evidence, tubes and containers for blood and urine samples, paper bags for collecting clothing and other physical evidence to test for hair fibers or other evidence, swabs for biological evidence collection such as saliva, blood, bodily fluids, skin cells, and hair, a large sheet of paper on which the victim undresses and collects hairs and fibers, dental floss, and wooden sticks for fingernail scrapings, glass slides, sterile water, and saline, and envelopes, boxes, and labels to hold evidence from each stage of the exam. Here are a series of interviews that we collected by people who are involved in the process.
So the first person we interviewed was Radnor Police Superintendent Flanagan, and the first thing he recommends doing when a rape has occurred is calling 911. The police then collect evidence such as social media, text calls, hair, clothes, DNA, testimony from witnesses, and videos. They can direct the victim to a hospital to see a sexual assault nurse examiner if needed. The police handle cases using their detectives, and if a rape has happened at a school or a college, they investigate separately from any efforts the school may use to handle the crime. Rapes are generally uncommon in Radnor. However, date rape is more prevalent, especially in places such as colleges, schools, and restaurants. A person's memory and reflexes are impacted by drugs, which is why there's an extended sentence if a rape involves those substances. And Superintendent Flanagan recommends having a safety plan, which consists of staying together with a group of people and not getting together with strangers.
Sexual assault nurse examiners have a variety of responsibilities, such as conducting forensic examinations, providing medical care, and emotional support and documentation. SANEs, such as Stately Rutland, perform a physical medical examination on the patient. This involves checking vital signs and patient history and documenting the story of the assault, treating cuts, bruises, bleeding, and other traumas, administering medications to prevent STIs, and collecting DNA evidence into the sexual assault examination kit. Providing emotional support to the patient is crucial, as there is a risk of re-traumatizing the patient. To prevent this, SANEs keep their patients informed, give breaks to the patient during the process, and let the patient know that they have control and allow them to decline any or all parts of the exam. SANEs may also refer to patients to additional mental health resources, such as a social worker or a victim center.
So another person we interviewed was Radnor's social worker, Isabel Cook. Her job is to prioritize the safety of the victim. She gets information about the timing of rape for medical purposes, since there's a specific window to receive an SANE examination. She collaborates with the Delaware County Victims Assistance. She informs victims of their rights, which is inlaid in the Victim's Bill of Rights. She answers any questions the victim may have, and she's bound by confidentiality rules, which means full confidentiality unless there's self-harm, harm of another person, or child abuse involved. She does not typically testify in court, but a representative may testify instead. She is also able to stay with the victim through an SANE examination or court. We also interviewed Candace Linehan from Delaware County Victims Assistance. The organization has a hotline that's open for 24 hours where victim advocates take calls. They make sure victims know their rights, potential services from the organization, and their options such as SANE exams, STI medication, police involvement, and protection from abuse orders. Delco Victims Assistance pairs an advocate with every victim to stay with them throughout the SANE process, the police process, and the court process. They may give suicide risk assessments, pro bono legal assistance in civil matters such as protection from abuse orders, custody, and divorce. And they have counseling and a victim financial compensation program. The organization abides by confidentiality rules, which covers every matter except self-harm, harm another person, or child abuse, and they do not testify in court.
Forensics professionals evaluate the evidence in sexual assault examination kits using various procedures. First, the professional analyzes the evidence collected and takes notes, drawings, and diagrams. Swabs are tested, and DNA on those swabs are prepared on a slide to be examined under a microscope. An extract of the swab may also be tested for P30. Samples are also prepared for DNA analysis and forwarded to the DNA lab for analysis. Forensics professionals collaborate with police departments, and the DA's office. The analyst or examiner will contact the police department for additional information to request additional evidence or a standard sample. Before going to court to testify, the ADA or the prosecutor will case conference with the analyst in preparation for testimony. All evidence from the sexual assault examination kits are sealed in a container and checked thoroughly by evidence intake to ensure that all the documentation is correct and the description and listing of the items match what is on the request form. The container is then assigned an item number, and the evidence is stored in a locked evidence room or refrigerator and freezer. The analyst is then assigned the case, and the evidence is transferred to the analyst. If there is an issue with packaging, it is rectified. Otherwise, the evidence is not accepted. Sample size can be a limitation for analyzing evidence. However, evidence can be stored for years. Additionally, samples involving drugs are analyzed in a drug section for analysis.
So we also interviewed Assistant District Attorney Danielle Gallagher from the Delaware County District Attorney's Office. So she said that for rape cases, there is a vertical prosecution process, which means the same prosecutors handle a case until it is finished. The process starts with a 911 call and police interference. The police investigate the case with ADA guidance, which includes such as what evidence they need to look for. The case is formed into a criminal complaint and an affidavit of probable cause, which consists of the case's facts, is produced. The case then goes to district court. Afterwards, a bail hearing takes place where bail depends on the crime the person committed or was accused of and whether or not the person has ever been convicted of a crime before. Being on bail means that the person accused of the crime may be forbidden to communicate with the victim, and bail can be rescinded if the person does not come to court when they are supposed to. Then a preliminary hearing occurs where the purpose is to prove that the case has sufficient facts attached to it. At this hearing, all that is necessary is the victim serving as a witness, and both the prosecution and defense get a chance to ask questions. And another hearing occurs where the accused tells the court their plea and the charges are stated. Afterwards is discovery, where the prosecution and defense exchange evidence. The next step is a pretrial conference where the trial is scheduled and the defense can request information on the status of the case. If the accused pleads not guilty, there's a trial. If the accused pleads guilty, there's a separate hearing dedicated to the plea where the judge ensures the defendant knows the conditions of a guilty plea, such as they don't get a trial. Then there is a sentencing hearing if the defendant is found guilty at trial and or after the judge accepts the defendant's guilty plea.
Counselors focus on healing trauma, restoring safety, and supporting empowerment. When counseling with survivors, counselors meet with clients' needs, practice mindfulness, and offer support groups like psychotherapy. Some typical responses to trauma are increased anxiety, flight or fight freeze, disassociation to protect themselves, PTSD symptoms, and sometimes substance abuse. PTSD can affect survivors' sleep, immune system, and stomach, and make them feel unsafe, easily triggered, and isolated. Trauma in a survivor can cause emotional dysregulation and heightened anxiety in the short term. In the long term, victims can face mental health challenges such as relationships and daily living, boundaries, coping, depression, and PTSD. To ensure that victims feel safe, counselors let them know that they are in control and help them navigate trust through avoiding words that may trigger the client, talk about things other than the assault, and let them know that they are in control of their disclosure.
So some key takeaways. A victim of rape has ultimate control over their situation, meaning that they are the decider when it comes to reporting their assault. If the victim does choose to report, there are a myriad of resources that are at their disposal.
The process to obtain justice and recovering from trauma is long and challenging, and it is crucial to recognize victims' experiences and take account of their struggles. By understanding the intensity victims go through, and even after the assault, survivors can feel validated and understood for their experiences.
A victim of sexual assault is never alone, even if it may feel that way. There are many people, including medical and legal professionals, among others, that care and are willing to help. Thank you.
Thank you so much. I would stay up. And does anybody have any questions for the students? I think this was an excellent presentation. I learned a lot that I didn't know. And I love the interviews and kind of speaking with people at different levels. Some of those people we know, some of those people I don't know. So I thought it was really helpful. Any questions?
I do have a question, and I just want to say this is such an important topic, so thank you both for your research and your thoroughness on this matter. It's greatly appreciated. Given that we have so many universities and colleges in the Radnor Township, it's really important to get this information out, especially to our students, right? My question is actually, how often do you know by chance the percentage of cases in which a rape kit is actually collected? Is it 20% of the time? I don't need to put you on the spot. I guess I was curious how often when they go to trial, they actually have the evidence in hand. maybe it's
Yeah.
something.
If you don't know, you can say you
It's all,
don't know.
it's
Yeah.
fine. We can
Yeah, I wonder.
follow up on that. I
Yeah,
think.
because like what percentage are reported? What percentage actually have a kit
Yeah,
taken?
taken at the hospital.
And I'd be interested to know like kind of what percentage of those kits are helpful as well.
And I think it's within 72 hours,
Yes, that's what-
right? That you
right?
said?
72
So
hours, you
it's important to get.
It is
Yeah.
like pretty difficult to get those kits like evaluated, especially since there's such like an uptake in those types of cases. So I would imagine that not many really get to that process, especially since a lot of people don't really have like the financial status to like afford to go through this like long process. So.
Mhm. Thank you.
This is something that probably as a physician I should know. Who employs the sexual assault nurses? Is it the hospitals or is it the government, like the municipality or the government? And once again, it's okay to say you don't know.
I think
just
it
wondering.
might be the hospital. Yeah.
Okay. Yeah, that would make sense to me.
And I was just going to ask, do the universities, if you know offhand, do they have awareness initiatives that are ongoing on campus about this situation and how students should be dealing with this
I've seen on like
or to prevent it?
the Villanova page, they have like some information on it, but like obviously it's like still a problem. Like recently, there was like a rape at Villanova, and like there was this person that like videoed it, and like they had to like put pressure out there to the school to like get him like not to be able to walk at graduation. So obviously it's like still a problem.
Yeah, it was nice to get that reminder of that the legal implications are different than a university investigation, that those are, considered separate. Any other questions, comments?
Yes, thank you for the presentation. It was a very good reminder and eye-opening about a number of issues. Could you go back to the slide with the pie chart on it?
Oh, yeah. Sorry.
It's way at the beginning. Yep. I think when you were talking about this, quoted a number in the realm of 1,700. Is this data about Radnor Township, or
No.
what is this data directly referring to?
I think it was I think it might have been Pennsylvania. Yeah.
Thank you.
I just had a question as well. So I also completed a student internship project with the League of Women Voters, and I was kind of just wondering, like, what inspired you guys to learn more about this topic specifically? Because I know for mine, like, when I was choosing it, this definitely wouldn't be, like, the first thing that came to mind. So I was just wondering if there was anything, like, specific that sort of inspired you guys to dive deeper into this topic.
For me, it's just like it's become like very important to like pay attention to people who have experienced like sexual assault and like domestic abuse, and I think it's something that people don't talk about enough, and that we should be talking about more. So,
I feel like for me, I felt like before I was doing this project that rape as a concept was very overlooked by society, and while doing this project and learning more about it, it really made me realize like how big the process was, because before even doing this project, I never would have realized how much like how extensive really like this process is to like obtain justice as a victim, and just learning about it, and I feel like presenting it to like groups of people is just really important to like make sure that society like as a whole knows that how long and painful a process like this is.
I think one thing is that, at least myself, I think about rape and sexual assault as a very macro issue, and you guys going through and talking about, if this happened in our township, what provider, what people would be working on this case, brought it very micro, kind of like reality, like, yes, this is happening in our township. These are the people that are involved. So thank you very much. It was great. Anything else? Wonderful. Thank you so, so much. Excellent job. All right, so bringing us to old business, the carpet installation. So I guess my first question is, Maggie, have they determined who is the contractor for this?
Not yet.
Okay, all right, great. So that brings, I really appreciate Lee. I had drafted a very short, non-specific statement, and Lee took it and ran with it. So my thought was, so for us to make an official recommendation to the Board of Commissioners, we need to vote and have, I believe, just a majority for Maggie to take the recommendation. Is that correct? Yes. Okay. So this statement, and I'll read it out loud, and you haven't been aware of this, Melissa, what we're discussing, so you may choose to recuse yourself, or if you feel like you hear enough information from this, may decide to participate. The statement, the Radnor Township Board of Health respectfully requests that the Radnor Township Board of Commissioners take the following considerations into account when selecting a contractor for the carpet replacement in the administration building. While recognizing the need to remain fiscally responsible, we encourage the township to choose an approach that reduces waste and minimizes environmental impact. Specifically, we ask that the township consider 1, the environmental effects associated with carpet manufacturing and installation. 2, the proper and responsible disposal of old carpeting to prevent unnecessary pollution. And 3, the use of recycled or sustainably sourced materials whenever feasible. By incorporating these practices into the project, the township can help protect public health, reduce pollution, and demonstrate our shared commitment to environmental stewardship. Any thoughts, questions about the statement before we have a little vote? Be exciting. I haven't done a vote.
I think it's a very well-crafted statement.
Thank you, Lee. So, having never done a vote before, do we go around or do we just ask for people to?
You can do a yay or nay.
Okay. All right.
Do we have our Zoom folks?
I believe we do.
Okay.
I believe we do. We can start with present and then we can move to Zoom. So I will say aye to the statement.
I will say aye and yay to the statement.
Interesting that aye and yay are the same 3 letters. Aye, yay.
Yay.
Lee and Aaron, are you still present?
So, sorry, yay.
Okay. Excellent. So any nays? I don't think so because we had our voting members are 6 votes. So I will send you a copy of the statement for you to share, Maggie.
Wonderful. I think I actually already have it because I saw it when you sent it
Excellent.
back.
It was exactly what Lee
Yeah.
had written. So
Yeah.
if you could just take that
Sounds
and bring it
wonderful.
to the Board of Commissioners, we'd really appreciate it.
Okay.
Excellent.
Thank you.
Thank you. All right, so that brings us to new business. Ms. Miller, I don't know if you had any comments about what's going on at the schools these days.
No, thank you. Good evening. First of all, I do want to say with that presentation, our school district has worked closely with the township, social worker, and Delco's victims. And we do have 3 social workers in our school district, one at the elementary, one at the middle school, and one at our high school. So that was, a lot of the information that they provided. Fortunately, we're staying up to date with it as well from the school district. The most recent information from our school nursing is, the uptick of congestion and the colds. And again, like I stated last month, we are just promoting the hand washing, the distance if children are home with a fever, or if they have a fever, to please stay home, and to be cleared of that within 24 hours. Most recently that came out this week is the Pennsylvania Youth Survey. That's conducted through the Commonwealth of Pennsylvania in grades 6th, 8th, 10th and 12th. So the district just got those results. We look at the mental health numbers that we have, and there were specific questions around mental health, drug and alcohol abuse, and then we will look at that data, and then from the district look at what our next action plans are to support our students and families. We have many contracted agencies that we work with in our school district, but then of course our school personnel as well.
When will kind of that information be processed and kind of disseminated? I guess?
Probably out by, well, it's out on the, it's available now, but we just received it today. So we'll start looking at it in the spring and see what our action plans are next year during the school year. But of course, we even look now and see what do we need to do within the new year, and get our local teams. We have student assistant programs. They're called SAP, again, mandated by the state in our school district. So we bring all that data to our SAP teams and then again, disseminate the information and see what we need to do within our school district.
Excellent, thank you.
Thank you.
All right, next to Board of Commissioners update.
Thanks. So we've been in budget season, which gives me anxiety, but it's not exactly a public health issue. And we passed the budget at the last meeting, so no more need be said. We did also at the last meeting, having introduced at the previous meeting, we passed the e-scooter, e-bike ordinance, which essentially bans e-scooters from all public property. So you can basically use it in your driveway, and that's it. E-bikes follow standard biking rules. They have to be class 1 or class 2, stay under 20 miles an hour, have a speedometer and appropriate lights if they're going at night. Minors must be helmeted. A lot of sort of safety issues. But one of the primary goals is we're pushing out a big education campaign. So, and it passed not unanimously, but we had one nay, and otherwise the entire board was for the ordinance. And we had a lot of input from Chief Flanagan about enforcement, which initially will be rather soft, but for minors, parents will be contacted, and if the kid's on a scooter, going to have to come and get them, that sort of thing. And otherwise reminders of the ordinance and helmet laws and that sort of thing. I didn't know this, but e-scooters were previously banned by the state on all roads. So I had thought that they could be on roads, but no, they can be on sidewalks, they can be in bike lanes, but not on any roads. I don't think they addressed private roads, so this would be a public road. So that we didn't really have to readdress. We did, however, ban them on places like the Radnor Trail. E-bikes are also banned on the Radnor Trail. You are allowed to say the only township property you can have your e-bike on is, say you're coming to a meeting at the township building and riding your e-bike. You can drive it onto the building and get to the, or going to a park, you can get to the bike rack. But then you have to leave the bike alone. You can't have it on any of the trails. So it's a pretty tight ordinance. And that's about it for public health.
But e-bikes are permitted in the bicycle lanes as designated, like on South Iton and
E-bikes are
E-bikes.
permitted anywhere a bike would be permitted. So bike lanes, yes, but they're also permitted on the, on the road. They have to follow the right directions, and you can't have more than, the way that the county phrased it was, more than one butt per seat. So, well, you see a lot of kids with dual riders at least. I mean, if you have 2 seats, you can have 2, but otherwise, just one rider per e-bike. And the faster sort of 40-mile-an-hour, 50-mile-an-hour e-bikes are banned.
I have a question, Maggie. It was in the local news that Lower Merion, I think it was last week, might have been 10 days ago, passed an ordinance mandating transition from gasoline to electric lawn leaf just leaf blowers, was it?
I think it's all two-stroke engine.
I think it's
So
all
it's weed whackers, I think, and leaf blowers, and some push mowers.
Right.
But the big mowers are just gasoline. They're not the oil. The nasty ones are the oil-gas mix. So we have our EAC looking at it now and working on that. You know, it has to be phased. The Lower Marion plan is to phase it in over years. So we've been talking about it for a while. We, as commissioners, asked our public works to lead by example, so they have ordered, and I believe they're in, though I haven't confirmed that, electric blowers and whackers.
I would like to express my utmost support for such actions. We live in a township where you really, during the summer, there are not many waking hours when you do not hear lawn equipment, and I can tell right away the difference between an electric and a gas.
I agree. The gas ones are so much louder. And the noxious fumes and those poor landscape folks, they often have ear protection, but you rarely see them with any kind of mask, and the fumes are really toxic.
This was actually one of the first topics that I took up 8 years ago when I first joined, and I guess it wasn't quite time yet, but I believe the time has come.
Well, I think that the hesitance, and I know the hesitance from our folks when I first approached, when I joined the Board of Commissioners, was that perhaps commercial standards weren't high enough in the electric realm, but now they purportedly are. So I'm all for it. And I agree, David. You hear them from basically dawn to dusk. And it's not just the summer. This is leaf collection season, so you'll hear teams of them going out. What happened to the good old rake?
Excellent. Thank you so much, Maggie. For update from the county, I was just looking at their a presentation from earlier this month at their meeting, it was they're excellent presentations and information about the current status of health in Delaware County. So I would recommend that people take a look at them. The talk from the 4th was actually about vaccinations. Discussing vaccination rates, looking at vaccination complications compared to number of deaths from the illnesses, really excellent information. Something that I thought would be important to just mention is that and I think we have mentioned this before, but I think it bears repeating, is that we are seeing a reduction in full vaccination panels for our kindergartners in the county. For 2023, 2024, 94.6% of kindergartners had gotten their full course of DTaP, and 94.3% had gotten for MMR. And we've discussed several times with the board that 95% is really that number we want. Looking back, they were looking at kindergartners, but they actually looked at like 8th graders. I believe I didn't write that data down, and 12th graders. This is versus our 12th graders for this past year. 97.9% had their full DDAP, and 98.5% had their full MMR. So that's a difference of 12. What has happened over 12 years? Of course, maybe some of those students had it after their kindergarten year, but I just find that concerning. They also had a great data information about zoster and reduction in herpes zoster. And as someone whose husband just had zoster as a 49-year-old right before he's 50, where he'll get his vaccination, it's not something to be kind of, no big deal, zoster. It's life, changing, job changing for a little while, possibly. He could not work around pregnant women, et cetera, so it really did influence his ability to work as an ER doctor, and obviously could affect other people significantly as well. This brings us to public participation this evening. Excellent, so no public participation this evening. Thank you, Roberta, for joining us. So any thoughts, questions before we adjourn our meeting this evening?
Well, I just have one thing. Sorry, Roberta. Go ahead.
I would just like to thank the Board of Health for always being willing to hear from our student interns, and also I would like to thank you as individuals for your service. Civic participation is important, and you are exemplars for the rest of our community. I hope others will read the list of vacancies and sign up. Thank you.
I agree with that. I wanted to bring up the sort of shattering news that hepatitis B vaccines do not have to be given to infants anymore. I just wanted to see David's expression when I did that. It's having a 2-year-old grandson and a bun in the oven. Not in my oven. In my daughter-in-law's oven. You know, she feels very strongly that if she has to pay for it out of her own pocket, she's going to get that baby hepatitis. And she knows pretty well that she's hepatitis B negative. But it's just one of these things that we're going to see a terrible resurgence of neonatal hepatitis B. And not necessarily from just the mom, you know, from other exposure to blood and bodily fluids. So toothbrushes, I mean, it's rather remarkable that, you know, what was just knee-jerk in the hospital to be given to babies is not going to be anymore. And as a former neonatologist, I feel strongly about that.
Yeah. Just when I thought I was out, you brought me back in. Because I think that above and beyond the fact that Americans and babies will be sick and die as a consequence of horrendous decision-making by our federal so-called health services, it represents just a direct rejection of science. If you want to reject science, fine. Throw away your iPhone, don't drive your car, never get on an airplane. It's all examples of science through engineering making your life better. And to me, the fascinating thing is that 2 of the safest vaccines with the most well-documented safety and benefit ratios, those would be measles vaccines and hepatitis B vaccines, have been the point of attack, and the absolute abandonment of scientific method in favor of pedagogy is hideous from my point of view.
You know what, I'm going to add an extra. I'm going to add my extra little sauce on top too. This was something that I had printed out a bit ago when we were talking about vaccinations, talking about Hepatitis Awareness Month in May. And I just wanted to read these 2 very short paragraphs, and then I will leave it go. Some parents wonder whether it's necessary to give the hepatitis B virus vaccine to newborns. They ask, how is a baby going to catch hepatitis B? Before the hepatitis B virus vaccine, every year in the United States, about 18,000 children less than 10 years old caught hepatitis B virus from someone other than their mother. Some children caught it from another family member, and some children caught it from someone outside the home who came into contact with the baby. Worse yet, many people don't realize that you can catch hepatitis B virus after coming in contact with very small quantities of blood, small enough that they're not visible to the naked eye. That means that someone can be infected through relatively casual contact with someone who is infected, such as sharing washcloths or toothbrushes. In fact, a milliliter of blood, about 1/5 of a teaspoon from someone who is infected, can contain as many as 1 billion infectious viruses. So, food for thought. All right, any other comments? Anyone move to adjourn?
Move to adjourn.
Second? Second. Meeting is adjourned.
We'll miss you guys.